One of the study skills we're taught very early in our academic careers is to create practice questions to help us prepare for an exam or other assessment. As students, we might encourage our instructors to give us study guides to help us through the material. Even better, they'll give us their own set of practice questions. Medical students, in particular, seek this form of a study aid. They see it as an essential tool to help them prepare for their high-stakes exams. But how are medical students using these practice questions? What do they find valuable about them, and is their use supported by our understanding of learning theory? How can faculty in medicine and other health professions best use practice questions to support student learning? Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. Today, we begin the first of a two-part series on a paper titled Medical Students' Use of Practice Questions in Their Studies, a Qualitative Study, published in the October 2024 issue of BMC Medical Education. Along with their colleagues, Davina Davis of the University of Tennessee Health Science Center and Marissa Roffler of the Rockhurst University. With us today are Dr. Trevor Sweatman. He's a professor in the College of Medicine at the University of Tennessee Health Science Center.
Thank you for the invitation.
Welcome, Trevor. Also, we have Dr. Devin Scott. He's an instructional consultant here in the Teach and Learning Center, also at the University of Tennessee Health Science Center.
Thanks for having me on, Tom.
Welcome, Devin. Next is Dr. Ryan Sheehy. Dr. Sheehy used to be at the University of Tennessee Health Science Center in the College of Medicine. He is now Associate Dean and Assistant Professor in the School of Medicine at the University of Kansas.
Yes, hello. Good to be here.
And finally, we have Dr. Eric Nemec. He's a Clinical Professor and Director of Research and Assessment at Sacred Heart University.
Hey, Tom. Good to see you.
Glad to have you all here. Let's just jump right into the questions. It was a really interesting article, and I'm glad to have you all here to talk about it. Ryan, could you talk to us a little bit about why practice questions are so popular amongst medical students to begin with?
That's a good question, and one that Trevor and I talked about outside of Starbucks. We were sitting there having a coffee, and we're actually bemoaning / thinking of ways to get around student evaluations or to, enact them. And because we had both gotten requests for more practice questions on our student evaluations. And we're like, gosh, we gave 10 last year, we gave 15 this year, but they want 20 next year. Like, how many more ways can I slice and dice this? And so we were sitting there and we're a bit flummoxed as to why they needed more. And so that's kind of was the whole impetus in the start of this project. So as to why they want practice questions or why they want more, that's why we asked them in the study.
What aspect of practice questions do medical students find most valuable, Trevor?
I think it depends largely on the medical student. One of the aspects that came across in the analysis was the fact that many students find the rationale in the question the most valuable part. And I think that gives us some encouragement, but it also gives us problems in terms of trying to give a reasonable rationale without re-lecturing the entire content all over again. And one of the other aspects of, certainly from my perspective in terms of pharmacology, is oftentimes if students, as they do, consult multiple resources, they will find conflicting information. And it's very difficult to try and encompass that information in a rationale because, as my favorite word to the medical class is, it depends. And medical students don't like that response because they want black and white. And unfortunately, medicine and pharmacology in general is largely gray all over. So it makes it problematic to try and capture the aspect that you want of the rationale without getting too deep in the weeds, because you're getting beyond the bounds of what's been covered in class at that point.
What about timing? You talk a little bit about in your paper about the timing of the practice questions. How does that relate to their purpose?
Yeah, we found that the timing of the practice question is pretty closely linked to what the students were intending to use the questions for. So early in their process, they start using the practice questions to study and actively learn material rather than just testing their knowledge. Like we as instructors often think that's what they're going to do. And like we've said so far, they use those explanations to build foundational knowledge. And then as exams approach, students start to shift towards using practice questions as an assessment tool to gauge how ready they are, identify weak areas, and reinforce retention.
Devin, we have students create their own practice questions as a way to enhance their own learning and understand what they know. Based on what you learned from the medical students, would that be effective?
Yes, but I would say students need training and guidance on how and why they're writing these practice questions, because if you just say write 10 practice questions as an assignment or as an activity, students are just going to write memorization style practice questions. They're going to just treat them like flashcards, and they're just going to write these very simple practice questions that aren't going to lead to a deeper understanding of the material and are not going to help them to grow. And so students need training and guidance on how to write practice questions based on cases, more complex questions, more deeper learning that is going to be needed. They're going to need guidance on how they should try to predict the types of questions that their faculty or professors will ask them, but that they'll see on certifying examinations. So the higher quality practice questions are absolutely going to be useful for students to write. Lower quality practice questions, I don't think they're that much more useful than students writing flashcards, which they're already going to do, or just reading a textbook and underlining material, because students are going to default to this path of least resistance for that assignment where they're going to just focus on memorization. Another thing to point out what Trevor and Eric were talking about was you should ask students to write a rationale when they write their practice questions, because that's going to help you to evaluate whether or not these are good practice questions, but also get them into thinking about the material more deeply. So yes, but perfect practice makes perfect. And so students need guidance on this. It's not a one size fits all.
Ryan, I thought it was really interesting to see in your paper that you talked about that students don't revisit these practice questions, that they just want new ones. So why is that?
Well, I don't really know the exact answer to that question, but my thinking is that they think it's a one and done. They already know the answer. So if I were to look at this question again later, it's useless to me because I already know the answer. In fact, this is something that when I'm working with students that are struggling in the curriculum, I'll ask them, do you do the formative assessments? Do you look at the practice questions? And they'll say yes. And I'll say, okay, well, when do you look at them? Some of them look at them in mid-block. Here at KU, we test every 2 weeks. So sometimes they'll look at them at the end of A week. Sometimes they'll look at them right before B week, right before the exam. And then I go, well, do you ever go back and look at them, or do you just try to answer? And they usually say, well, I just try to answer. Although there is the rare student that will say, well, then I also try to think about why the incorrect answers are incorrect. Or then I try to make the case change what's written in the case, or the stem of the question, to make the incorrect answer correct. And that's often there's so much more to a practice question you can do than just answer it or just read the rationale. And I think sometimes students don't realize that there's more than just answering the question that you can do with it.
I'm thinking back to your conversation with Trevor outside of that Starbucks. And yeah, students are going to ask for 20, 25, 30, 35, 40. They're going to ask for more and more practice questions if they're single use, if they're not digging in deeply, because, you can run through 20 practice questions in 20 minutes, right? And so they're going to want more and more if they're just using them as single use.
Yeah, I think that was another reason why they really wanted practice questions. And I remember talking to Trevor about, I felt like they were just trying to memorize all the different configurations you could arrange the furniture in the living room. And then they could use pattern recognition to almost hack the information of the exam. And I think there's a place for pattern recognition in medical education and medical diagnosis. But it's interesting to me. There's only so many ways. There's only so at KU, we try to give them formative assessments for certain sessions that we call them exhaustive, where we can't give you any more. These are exhaustive formative assessments. We can only write 37 questions on this topic. That's all we got. And so I think that piece of communication helps because they don't ask for more when we say that they're exhaustive.
But doing that many questions, Ryan, aren't they potentially missing the essential concept behind the question? Just simply coming out with a pattern recognition, as you say, is fine. But if they don't understand the underlying concept, which translates into other areas, especially as you know in pharmacology, they've rather missed the purpose of that learning point.
Yeah, and I think that that's part of the weakness of practice questions is that they're kind of in the moment learning.
Yeah.
They're not connecting topics across sessions or across blocks or across modules. Yeah, I would agree. That's a weakness.
And I think one of the other, again, from my perspective as a pharmacologist, and Ryan will appreciate this, you can only construct a practice question on the basis of the information that you've already covered in class. Bearing in mind that there's so much more out there, especially when you're trying to teach pharmacology in an organ system approach. And pharmacology is not organ-based, it's systems-based. That the types of questions that you can construct for practice are not at the same level as they might be for a USMLE question, where they are looking back on the entire body of pharmacology and are able to construct questions that are a little bit more complex. They've got different abilities in constructing distractor answers. And if you haven't covered that yet in class, you can't have that type of distraction in. You've got to constantly constrain yourself. So it does make for I'm going to say weaker, it makes for a weaker practice question as you're going along incrementally throughout the curriculum.
It makes them hard to write too, because you have to write for what you're teaching now. And you can't usually use a USMLE resource because it's taking in those other areas that they haven't gotten to yet.
Well, and then on top of that, to your both of your points, your students have a false sense of confidence if they get these practice questions correct. Oh, I'm set for USMLE. I know all this material, when really you were very limited in the complexity of the practice question you could write, and to your point, the distractors you could write.
I think that's a good segue into the next question is, how might we think about how medical students integrate practice questions into other learning strategies? Because it's not just good enough to be able to answer the practice questions, right? There have to be other things going on to help them understand this material.
Certainly there does, but we have to sort of superimpose on that the aspect of an increasingly large segment of the class who don't want to learn in person, who are learning remotely. So they may be using different strategies for their learning, absent the sense of being directly interfacing with a faculty member. And I find that such a disappointing aspect these days, that we can't have a conversation in the classroom about a topic because the individual, the other party in the conversation, doesn't want to be there. So I think the students who come to class most likely use a different learning strategy than the ones who are doing it remotely, asynchronously, whenever they're doing it. And that's an interesting aspect that would be worth exploring. How the people that do asynchronous remote learning, in the sense of not coming to class, how does their strategy differ from the students who actually come to class? Because you've got the dynamics, the momentum, if we can use that expression, of the discussion going on in the classroom. And I think they're missing out on that.
And I think that you're getting to one of our later questions about opportunities for future research.
Oh, absolutely. There's a lot of research could be done here. Yes.
What about larger implications of your study in medical education? What are the larger implications?
Devin mentioned that students often want more and more questions, and he's right, they do. But Trevor also very astutely stated that, especially in pharmacology, which I also teach, it's really hard to give a high-level question when we have a very myopic topic, right? Very organ systems, not body systems. And so it's really, really hard to continually write those questions. But I think as reflective educators, things we probably do want to consider is giving the students questions when we can, right? Give them early so they can integrate them earlier in the curriculum, rather than just before exams. And I think that along with that, when we're providing these question banks, we do want to try to give detailed rationale when also possible, because students are perceiving this again as a primary learning experience, right? And often as a one and done. If we can help to explain and further deepen their understanding of the material, however narrow it is, I think we'll have better outcomes for that. And the other thing that I think we should consider is being more active in our discussion with our students of how they're going to use these questions, right? Because they've told us that repeating the same questions is perceived as less effective, we might want to tell them up front to space it out a little bit more, use a little bit of spaced repetition, or find a platform that offers adaptive question banks where you can ask the same thing in multiple different ways. Or if any of that fails, ask them to, provide rationale and explain their reasoning in different ways for each of the questions to try to encourage deeper processing.
Trevor mentioned a little bit earlier, and I think this is a national problem of students not coming to class and expecting everything to be done at home. Is there a way to think about practice questions as a way to entice students back into the classroom?
I mean, maybe, but that's been shown in quite a few different studies that attendance isn't directly tied to outcome. And I think that that's going to be the hard piece there. And you're going to get a student in class that's not going to want to be there. And sometimes as an instructor, those are the students you don't want in your classroom because they can derail it. They're the students that will be there just up until you give them the practice questions, and then you have a mass exodus of like 60, 70 people. That's very disruptive in the middle of your topic. So I don't think I'd be in favor of using it as an incentive, but I think it could be used. I think you could incentivize it. I don't know. I think there's a way to try to put practice questions in some sort of platform to space it out, or to maybe gatekeep to get them to use other materials as primary learning materials. I don't know. And that's something that we'd have to explore further.
What would happen if you made them available for a limited period of time? So one of the things I do with my physician assistant's pharmacology course is I give them a 10-question post-study quiz that's only available for 2 days and then it's gone. It encourages them to reflect upon what they've heard in the classroom and then go and try and answer the questions. And there's a small carrot there in that they get a fractional percentage of their semester grade from completing all of those assignments. But it's the immediacy of it. I want them to do those quiz questions now and not wait until the night before the assessment. And I think that so far, touch wood, gently, that's been very good in encouraging the students to keep up. And that's one of the problems that you have with students who are struggling, is that one of the things that they do first of all is fall behind. And as we all know, the rest of the class doesn't wait for them. So they become increasingly stressed as a consequence of that. And that would potentially push them towards using the practice questions in a more inappropriate way.
To your point about keeping up, I think that is sort of the key there for these time-based practice questions, because I could see if you give practice questions over 2 days and you have a student that is not caught up and is not with you, they're using it only for primary learning. Then they're just, they're having to do it in those 2-day period, and then they're not using it for self-assessment at all. But for all of your students who are on track, have done their primary learning, know the material, and are using the questions for assessment, yeah, I think that's a powerful tool to give it to them at that point after they've already learned the material.
And that's this most episode of Teach Well, Learn Well. Thank you to Dr. Trevor Swebman, Dr. Devin Scott, Dr. Ryan Sheehy, and Dr. Eric Nemec for their time. Join us next month for part 2 of our interview as we dig deeper into the theory behind how students are using practice questions. I'm Tom Lochner at the Teach Well Learning Center at the University of Tennessee Health Science Center. Until next time.